Hello, I'm Faye and welcome to our documentary about gender inequality in healthcare. The people who are involved in this documentary are Sarah, Elise, Flavie, Alyssa, Lander and Quentin.
We are going to do research about what the consequences are of unequal opportunities for women in healthcare.
We are going to divide the question into parts.
We will discuss the question related to the patients and the professionals.
For this documentary alone, we will have the honor to speak with Mrs. Waters, who works in Maria Milares, a hospital in Ghent. We will ask her some interesting questions who will provide us a general view about this topic.
These two important elements will help us give a better understanding about discrimination in the health sector.
Until 1990, it was common for health studies to be carried out almost exclusively on men. The result is that doctors and scientists know much less about women's bodies, women's illnesses, and women's reactions to drugs than about men's health issues. The reason for the focus on men is that it's difficult to include pregnant women in a trial. Another reason is that it's often provided that women have fluctuating hormone levels. It's much cheaper to study one sex, is a comment given by a male scientist. The tendency to focus on males, researchers now realize, may have harmed women's health. Women die or suffer more than males do as a result, and they are frequently difficult to identify.
To learn more about this topic, I went to Maria Milares, a hospital in Ghent, where Dr. De Voort works as a female surgeon. What is the ratio of men to women in your department?
Wij zijn met 12 in totaal. We zijn met 10 mannen en 2 vrouwen.
Okay. Do you have the feeling that you are disadvantaged as women in your task?
Ik denk niet onmiddellijk, maar het is wel zo, als ik er een keer over nadenk, dat bijvoorbeeld tijdens de opleiding tot chirurg, ik had soms wel de indruk dat wij ons iets als vrouw meer moesten gaan bewijzen, wat meer ons best moesten doen, om aan onze supervisoren of aan onze stagemeester te tonen dat we het eigenlijk even goed of zelfs beter konden. Dus we waren soms wel wat meer gedreven, bleven wat langer, werkten wat langer, deden wat meer ons best en finaal werd dat dan ook wel gezien of geapprecieerd. Maar bij een man ging dat wel iets vlotter.
One of the most striking aspects of gender equality in healthcare is the unequal representation of men and women in leadership roles. Although women make up a significant proportion of the healthcare workforce, more than men in most situations, they are underrepresented in leadership roles and decision-making bodies. This phenomenon is known as the glass ceiling, with women struggling to reach top positions within the sector despite their qualifications and experience. Besides the challenge faced by the healthcare workers, gender equality in healthcare also has a direct impact on patients. Some research suggests that gender bias exists in medical treatment, with women's needs being taken less seriously or their symptoms being interpreted different from men's. This can lead to misdiagnosis or suboptimal care. Countless women have told stories of medical staff ignoring or dismissing them.
According to a 2019 survey, more than half of women, compared to roughly 30% of males, think that gender discrimination in patient care is a major issue. 20% of women said that they have felt ignored or written off by a healthcare professional, and 17% said that they have experienced discrimination due to their gender. Compared to men, women are less likely to receive painkillers. In emergency rooms, they have to wait longer to get pain medication. They are more likely to hear that their suffering is psychosomatic, that is internal to them. And all of this is true, even though women are more likely than males to have chronic pain. So all in all, women are taking a loss less seriously than men, and that needs to change.
Do you have the impression that female surgeons are approached differently by their patients than her male collega's?
Ja, dat misschien soms wel. Ik heb toch de indruk dat als ze op consultatie komen, dat ze dan op het einde nog een keer bevestiging vragen of ik het wel ben die ga opereren. Of ze nemen mij als verpleegkundige voor en dan vragen ze wanneer dat de chirurg komt. Omdat ze nog altijd het idee hebben dat een chirurg mannelijk is. Dan voornamelijk bij oudere patiënten. Zo ben ik een keer met een jongere mannelijke assistent gaan toeren. In een weekend moesten we patiënten gaan zien. En we hadden ons nogthans correct voorgesteld. En die oudere man heeft continu zijn gesprek gericht tot de jonge assistent. Al zijn vragen gesteld. En ook mij echt aanschouwd als een assistent. Dus dat was in zijn hoofd was het onmogelijk dat ik de chirurg was.
The impact of being treated differently in healthcare can affect you in different ways. Physically, mentally, access to the right care and also quality of life. Physically, for example, is that if you are misdiagnosed, it can lead to negative effects on your health. Mentally, it can lead to stress and fear because you feel that you are not taken seriously, that you cannot get the care you need.
This can also make you feel less confident in the healthcare sector. In addition, you may also start to have less access to proper care. Being treated differently may lead to barriers in accessing necessary medical care. And finally, it can affect the quality of your life, especially if you have long-term health problems.
Addressing gender equality in healthcare needs focused efforts. 1. Employment policies that promote gender equality in healthcare, including laws against discrimination, support for reproductive rights, and the provisions of inclusive healthcare service.
2. Conduct awareness campaigns to inform the public about gender disparities in healthcare. This can help reduce stigma and improve access to care for all genders.
3. Ensure equal opportunities for career advancement and close the gender gap in healthcare professions. Implement transparent salary structures and policies that eliminate wage disparities. 4. Equal pay and benefits. Ensure gender pay equity within the healthcare sector by conducting regular pay audits and implementing transparent salary structures. Equal pay for equal work is fundamental to rectifying gender disparities.